Welcome back, everybody. Our pet extravaganza. We are back with Dr. Eric from the St. Paul Pet Hospital. Now, here's the deal. On our Facebook page, we gave you all the chance to post your questions for the doctor. And my goodness, you need to come back for like 80 segments because we got about 4,000 questions. Let's get to the first one from Carol. What up, Carol? She writes, my 19-year-old cat. And first of all, can we just congratulate the cat on being 19? Anyway, my 19-year-old cat has arthritis and is getting CBD oil, and it has literally saved her. Your thoughts? I don't even know what CBD oil is.
So CBD oil is cannabidiol oil that is extracted. It's the non-psychoactive component. A lot of people think of marijuana like that's the THC or tetrahydro. It's not cannabidiol, cannabinoid. But that is the psychoactive agent, and some strains of marijuana have been bred to have high levels of CBD or cannabidiol with none of the psychoactive component in it.
Okay.
The thing, Carol, that you need to remember in this instance is that CBD is still not legal and still classified as a Schedule I drug, which is a heroin, ecstasy, all of the hard drugs that have high levels of abuse and high levels of potential addiction. We obviously know that in certain states we're starting to deregulate, but there's not enough information right now. And in Carol's situation in particular, this cat is probably suffering from probably some other conditions that we have on the veterinary side. We have other drugs that are much safer, much more effective, that we have proven history and a proven track record. So that's, I think, an important thing to remember.
Yeah, we got so many emails about it. Again, we could do a whole other segment. Next, let's go to Kim. Kim, now I know this is a breakfast show, but we got a lot. This is just reality, folks. Sorry. I've tried everything, Kim writes, but any tips on dogs that eat their own waste?
So we have to remember that our dogs they're remnants of wolves, we all know that, and that actually recycling some food once in a while was actually a very normal and an actual beneficial, evolutionarily advantageous behavior. And so it is sometimes very difficult to train that away. There are some very specific things. If you can give a correction quickly when that is happening, the most important thing is just cleaning up poop right away.
Yeah.
Just being out there, cleaning it up. That's the best way to break that cycle. And if you can't, for whatever reason, if they're doing that, if there's a way to give a corrective measure within 2 to 3 seconds of them doing that,
yeah,
that's the only real thing. It is frustrating. It really is.
Especially for Frenchie owners. Frenchies are really bad at it, I heard. Joanne, just saying. Joanne writes, hey, doctor, how do you brush your small dog's teeth when they keep biting you?
Joanne, I really got to congratulate you for trying to do that. That is a difficult task.
Yeah.
And less than 1% of all pet owners do attempt to brush their dogs or cats'
brushing their teeth. I get those Dentabones or something.
So there is only one approved FDA product right now that actually is labeled for the prevention of halitosis and plaque formation. And it's a product called Oravet Chews, and they've impregnated this diphenyl product that coats and seals the tooth, and it actually prevents the bacteria that's in your mouth, the porphyromonas bacteria, from grabbing onto the tooth. So there's only one product that I know of now that has an FDA label for that. So how do you prevent them from biting you? When we think about brushing your own teeth, that's a very sensitive thing that you're doing.
Yeah.
You got to think about how microscopically you're changing the angle of your the toothbrush head. So it's very, very hard for us to try to do it to a patient that's small and it's like I said, very sensitive. So I try to give products that promote chewing. I'm sorry, but things like Greenies, Milkbone, those companies are really good at marketing. They're not great at developing a product that actually prevents plaque and tartar.
I'll stop. Okay, one more. Tammy goes, shared a picture of her cats. She says, George snores. This is George. Never heard a cat snore so loud. Is that common? I love that we're ending on this question, by the way, but yeah.
Well, George, I was thinking George was going to be one of those Persians or a smashed-faced cat, and then I would have a really good answer. Yes, it's common. But if it's something that's been going on for the cat's entire life, probably not as big of an issue. If it's something that's just recently onset, there can be specific diseases in the back of the throat that can cause that. But I don't have a good answer for you on that one.
George, go to the doctor, girl. Go to the
That's what I was going to say. Yeah,
go see Dr. Eric. Dr. Eric from the St. Paul Pet Hospital. If you don't worry, if you missed any of this, we'll put this whole segment on Facebook page and we'll have the doctor back. And be sure to check out stpaulpet.com.